Julie, did you ever get the feeling after you had a conversation with a family member, or for many financial professionals, I'm sure with a client, about Medicare, supplemental insurance, all that kind of stuff, where you just feel like, I'm not sure that was a good conversation?
Absolutely. I've had many of those recently with family members, and it sounds like alphabet soup to me, frankly. I haven't done my research, and oftentimes I find myself nodding in agreement, and I'm not really even sure what I'm agreeing to. So I don't feel as if I'm giving good guidance, but honestly, I have no idea where to go to gather that guidance.
And it was those kind of conversations, I think, that kind of inspired this podcast episode that we did with Dave Francis from Healthpilot about how to plan for healthcare costs, aligning needs with coverage. And so, hey, let's go listen to what Dave has to say about how we might have better conversations around this topic. Hi, I'm John.
And I'm Julie.
We're the hosts of the Hartford Fund's Human Centric Investing Podcast.
Every other week, we're talking with inspiring thought leaders to hear their best ideas for how you can transform your relationships with your clients.
Let's go. Dave Francis is founder and CEO of Healthpilot. For 3 decades, Dave has been at the forefront of leveraging information technology in the healthcare market. With a passion for improving the customer experience in healthcare and a strong belief that transformation of individual wellness and market efficiency can be gained only by focusing on each individual customer within the context of the larger market, Dave co-founded Healthpilot to be a deep trusted partner of every healthcare consumer. Prior to co-founding Healthpilot, Dave was Chief Operating Officer and Chief Financial Officer at eHealth, where he led the company's turnaround and growth from 2016 to 2020. Under Dave's leadership, eHealth's stock price rose by more than 10 times during his tenure. Prior to eHealth, Dave was an industry-leading investment banker and research analyst focused on the healthcare information technology industry at leading Wall Street firms, including the Royal Bank of Canada and Jefferies and Company. Dave is well known for his strategic vision in the healthcare and technology markets and is a frequent speaker and guest lecturer on finance, healthcare, and technology innovation. Dave earned a BS in economics from the Wharton School of the University of Pennsylvania. Dave, welcome to our podcast.
Thanks for having me. It's good to be here.
So, Dave, I think with all the recent talk about inflation, I think most people are aware that healthcare inflation has historically run ahead of core inflation by quite a large margin. But I think because inflation is on everyone's mind, everyone's looking at healthcare costs and thinking about how is it possible to minimize healthcare costs in retirement. And I think when I, as a financial professional myself, when I think of healthcare costs, sometimes I kind of default to, oh, Medicare will take care of everything. Can you start us there and
Right.
maybe describe for us a little bit about why that probably represents a problem in our industry these days?
No, it's a great question, and again, I appreciate you guys having me on. Healthcare costs for seniors in particular is a really consequential issue for folks. And if you think about seniors as they enter retirement and they live their lives through retirement, oftentimes they're asking their financial advisor two questions as they reach this stage in their lives. One is, do I have enough do I have enough money to retire the way that I want to? And then the second is, can you help me with this Medicare thing, because I'm no longer on my employer's health insurance, and I know that the government has health insurance for me, but I keep getting these messages that there's a lot that I need to be considering around that. And the healthcare problem for folks these days is something that is big and only getting bigger. And inflation generally is further compounding that issue. So when you think about Medicare, Medicare insurance from the government covers a lot of a person's healthcare costs, but really doesn't solve the entire cost problem for them. Medicare generally covers, when you think about hospital visits and things like that, only covers about 80% of a person's healthcare expenses. And on top of that, the drug side isn't really covered by original Medicare, and premiums within Medicare. People think that they've paid into Medicare Medicare, so they just get it for free at the end of the day. They actually have premiums taken out of their Social Security account, and those premiums, particularly on what's called the Part B side of Medicare, have been going up considerably over the last several years. So inflation generally is causing a problem for folks relative to having a fixed income and limited financial resources. Healthcare costs are going up. The way that insurance is taken care of relative to Medicare and what have you is not a silver bullet for them. So there's a lot to be concerned about, to be thinking about as people are reaching a retirement age, and for those folks that are in retirement, healthcare costs are always going to be an issue, and figuring out a way to manage those most effectively is something that we do here at Healthpilot.
Dave, that makes perfect sense. And, when I think about so many financial professionals, myself included, studied some of these concepts, maybe for an insurance license, maybe a few decades ago. And, if you're not entrenched in these conversations every single day, if this hasn't become really the core or the niche of one's financial advisory practice, I believe that things change so quickly, and the rules, the policies, the programs, it's just hard to wrap one's arms around. I know that just yesterday, in fact, I was having this conversation with my mom. My parents are 64, and she's been helping my grandmother, who is in failing health, sort of adjust her Medicare plan. And my mom is trying to figure out, how do all of the pieces work together, right? How does their primary medical work with Medicare and all the different parts? What are they paying for? How can all of the pieces talk to each other? And she actually, I had to laugh, but I thought it made kind of some sense in the moment. My family's never met a spreadsheet they didn't love. And so she actually created a spreadsheet of all of the different Medicare programs and plans. And she has been querying all of her friends. What do they subscribe to? How much do they pay? What ailments do they have? And why did they choose it? I thought it was actually a very creative way to sort of get to the bottom of this. I don't think she's come to any conclusions. Like I said, I was very proud of it, and I'm excited to review her findings. But if you think about sort of the interconnectedness of all of that, my guess is that many financial professionals are in the same situation, right? Asking clients about some of these high-level health issues, looking at current plans. Can you talk us through, what some resources may be to help sort of that integration of all of this, so that at the end of the day, our financial professionals feel as if they've guided their clients in a way that makes sense, and clients can lay their head down at night saying, I've got the coverage that I need, I feel comfortable with it, and maybe most importantly, I'm not overpaying for resources that don't even apply to my situation right now or even in the future.
Yeah. No, there's a lot to unpack in there, and I'll tell you, I want to see that spreadsheet at some point in time, because I'm sure that
I'd be glad to share
it's
it.
a work of art, and it's the kind of thing where it's so hard to wrap your head around all of the different things that you need to consider on an individualized basis as it relates to health insurance, particularly for seniors in a Medicare environment. Every single individual. Well, let me take a step back. Financial advisory professionals you've got a lot on your plate. So there's so much that you need to be thinking about as it relates to all of your clients, and particularly those that are approaching and then in retirement age, relative to making sure that the asset base is there, that it's protected correctly, and that it's going to last your client throughout their retirement time, so that they can live their best life in retirement. That's what everybody is aiming to do. When you think about everything that's involved in the healthcare decision-making process, it is an entirely different and complex set of questions and regulations and inputs and outputs that it doesn't make sense, and it's virtually impossible for someone in your seat to be able to master both the financial side of things and the healthcare side of things. On top of that, there's all kinds of licensing requirements and regulatory requirements. It really is virtually impossible for anybody in your shoes to be able to master both of those, which means that more often than not, a financial advisor, when asked the question by a retiree or a soon-to-be retiree, hey, can you help me with this Medicare insurance thing? More often than not, and we've done some recent studies, I'll share some data with you. More often than not, that professional is referring your client out to somebody else. I know a guy, and as a result, result, hopefully you've got a trusted relationship with somebody in the Medicare insurance space that you can take your client to, but you lose track of what's going on with your client, a person with whom you've been working for years, if not decades, to build this financial plan and nest egg for, and you have no idea what's happening to them when they go outside of your network or your ecosystem to solve for this Medicare insurance thing. And a lot of things that need to be accounted for there, particularly what is the premium that my client is paying for health insurance? Are they properly insured in the first place? What's their expected out-of-pocket cost every year for healthcare, and how does that relate back to the financial plan that I've been building for this client for years? All of that goes dark, and you're kind of rolling on a wing and a prayer and some rough estimates relative to, well, I think this is what it's going to do to impact what the Medicare insurance is going to do to impact my client's financial plan, but you really just don't know. The other piece that you struggle with is as you say, what are the resources that either I as a financial advisor or that I can pass on to my client to use to figure out this whole Medicare thing. There really aren't any good trusted sources of easy to digest, easy to access, easy to understand information that let people figure out, okay, in my circumstances, given the doctors I see, the drugs that I take, my current health status, my current economic status, what's best for me from a health insurance perspective? I usually relied on IBM or Coca-Cola or Comcast or whoever my employer was to guide me in the right direction for this is the plan, or these are the sets of plans to choose one. In the Medicare market, it is unbelievable the number of options and different types of products, different types of plans, what's covered, what's not covered, what are my copays, the permutations of different financial impacts for these things are they're exponential in terms of the complexity. And back to your point of where do you go to get help for this? There are a few resources out there. A lot of people visit Medicare.gov, the government website for all things Medicare. There's a lot of information there, but you've got to rely on your own smarts to kind of figure it out. And then back to your point, the really diligent folks will build their own spreadsheet and still not feel terribly confident or comfortable that they're making a really good decision. It seems as though this is something that somebody ought to be able to build a technology platform around to help people out for. And amazingly, nobody had ever done it until now. And that's what we set about to do at Healthpilot. And so when you look for a resource, whether you're a financial advisor or an individual customer, we believe that we've built everything there to help you figure out what's best for you, and then use the technology to find exactly the best plan for your health and economic circumstances today.
So, Dave, I hope that this podcast is successful, because following you, I think we're going to have Julie's mom on, and so to walk us through the spreadsheet, and we'll see how that goes. But when you were just talking through some of those points, I think I heard, but I want to ask you more directly about what are some of the major levers, right? Some of the very high level levers that a financial professional might want to be listening for in a conversation with a client, either about current health condition or status, or even changes as the client ages. Like, obviously one that comes to mind are the types of pharmaceuticals that they're taking, the drug platform, because there are a lot of people out there that don't even understand, do I need to do Medicare Part D? Is that my only option? What are the options if I don't do that? What's the difference between self-insuring and finding outside insurance that covers that? So I would think that those formularies are one, but are there a couple of high-level levers that financial professionals ought to at least be listening for?
So let me answer it this way. You're absolutely right. And let's just throw a little bit of a word salad out there. Medicare Part A, Medicare Part B, Medicare Part D, Medicare Part C, copays, deductibles, premiums, total out-of-pocket, annual out-of-pocket, drug premiums, donut holes, you name it. There's just a few of the multitude of buzzwords and alphabet soup kind of things that one runs into when they start to look at Medicare. And that's why as we look at financial advisors and everything that you all have to do to serve your clients, trying to figure all of that out is a virtual impossibility, and asking you as a financial advisor to engage with your customer to help them with all of that stuff on the healthcare side it's an impossible task. And candidly, it's an impossible task even for Medicare experts. I will tell you, when I help my folks through this process, it's very difficult, even knowing as much as I know about the marketplace, to explain to them in easy to understand terms, hey, this is why this plan is better than this plan, or this product is better than this product for you, and here's why. And that's why, quite frankly, we built Healthpilot, which was to take the burden of Medicare insurance completely off the shoulders of you, the financial advisor, on behalf of your client, and for your client themselves, and be able to solve this problem for the rest of their lives, and be able to help people that don't understand that there are different parts of Medicare insurance. What's the difference between Medicare Advantage and Medicare Supplement? What is a Part D drug plan, and how does that fit into the whole process? It's too much for any individual person to really understand and then keep track of all the changes in the marketplace. When you think about a single individual, and we always talk about a Mrs. Smith. Mrs. Smith is kind of our poster child. She is the person who needs help figuring out what is best for her. And there are 65 million Mrs. Smiths in the marketplace today. Each of whom is different in terms of their specific needs from a health and economic perspective today relative to what they need from a health insurance perspective. And those needs will change over time. So, you touched on a few of the things, but the big picture things that are really important to an individual client of yours is, who's my doctor? Do I like my doctor? And can I find a plan that fits for me, that has my doctor in network? You can actually find a plan that lets you keep your doctor, as an example. What drugs do I take? Are they fully covered? And if I take different drugs over time, is somebody helping me monitor that so that I can make sure that the insurance I have today is the right insurance that I need down the road? When I first retire, I might be looking to do some traveling, and I have some extra discretionary income that I'll be going out to do some additional things with. I might have a vacation home, so I've got a home in Michigan and a home in Florida. How does my health insurance plan fit into that, and what kind of products and considerations should there be around that? There's an awful lot that goes into that. That is just very difficult for an individual broker on the Medicare side, and certainly for a financial advisor to keep track of and be able to manage, particularly knowing that the increase in the number of health plans, the different companies and insurance companies that have been coming into this marketplace over the last several years, has just been growing and growing and growing because of the economic opportunities for those folks. Just as a quick example, the number of Medicare Advantage plans, you hear a lot about Medicare Advantage, and about 4 in 10 seniors are covered by a Medicare Advantage plan today. The number of those plans in the last 7 years has doubled from 3,000 to 6,000 across the country. That's just one product segment, and the complexity in figuring out and tracking what's covered in each of those and what's best for me as a customer, it's impossible to do without the help of technology and something like what we have built here at Healthpilot. That focuses on the individual needs of each of those specific customers and clients of yours, to figure out what is the best product for them, and help them enroll in that in a way that's very easy, confidence inspiring, and lets them live comfortably knowing that, hey, I'm in the right health insurance product. I know that I can get the health care I need. I know it's not going to bankrupt me, and I don't have to worry about it anymore. So I can go out there and live my retirement life the best way possible, which is what you've been doing to try and help them from a financial perspective the whole way. We come alongside the financial advisor as a technology partner to allow you to help your customer live live and take care of this very consequential decision for them today and for the rest of their lives.
Dave, I'm certainly intrigued, and at the risk of making my mom's beautiful spreadsheet obsolete, would you give us a brief overview of, if I'm a financial professional logging on to your technology platform, what information might I need, or what does that process look like for me to input some data for a client who's asking about where do I go, what path should I head down?
Sure. For a financial advisor, it's simple. We have made the entire process, both for the financial advisor and for your client, the customer, drop dead simple. So for a financial advisor, we equip you with a portal and also an entry point, either through Money Guide or through Redtail or through Wealthbox, any of the CRMs that you might use, an easy touch point to essentially refer your client into our platform, typically through an email. You simply click on Mrs. Smith's information and send her an email that we've already pre-populated for you that essentially says, Mrs. Smith, I'm introducing you to the folks at Healthpilot and their easy to use platform to help you find and enroll in the best Medicare insurance plan for you. It'll take you about 15 minutes, but you'll be able to have confidence that when you're done with the process, that you're enrolled in the best health insurance plan for you, given your health and economic circumstances, your doctors and drugs, and everything will be taken care of for you. On the back end of that process, once you've referred Mrs. Smith into the Healthpilot platform and she ultimately enrolls in a product, we close the loop with you, the financial advisor, so that through that data integration, we're able to tell you Mrs. Smith is enrolled in this specific health insurance product. Her expected out-of-pocket cost this year will be $6,422. You can work that confidently into your financial plan. And now, instead of guessing as to A, is she properly covered, and B, what is it going to cost her to have health insurance this year, you now have a rock solid basis around which to take care of that piece of the financial plan and know that the rest of the financial plan is protected from an insurance perspective on the healthcare side and something that you can rely on going forward relative to her financial position on a go forward basis.
Well, Dave, on behalf of our listeners, thanks for taking the time today to kind of educate us a little bit about some of these topics. It sounds like it's an area where there is gross inefficiency, and that's probably a good area for us to look, especially when it comes time for cost savings or, more than anything, improving the customer experience. So for those of you listening today who would like to find out more about Dave and the Healthpilot company, you can visit healthpilot.com/advisor to begin your journey in making healthcare easy, efficient, and effective for your senior clients. Certainly gives you another alternative to consider when it comes to having healthcare cost conversations with your clients. So Dave, thanks again for joining us.
Appreciate the time, you guys. Thank you.
Thanks for listening to the Hartford Funds Human-Centric Investing Podcast. If you'd like to tune in for more episodes, don't forget to subscribe wherever you get your podcasts and follow us on LinkedIn, Twitter, or YouTube.
And if you'd like to be a guest and share your best ideas for transforming client relationships, email us at guestbooking@hartfordfunds.com. We'd love to hear from you.
Talk to you soon.